All right, so I'm going to turn it over to Shelley. And Shelley, I'm going to let you introduce Dr. Ross and talk a little bit about what we're going to accomplish tonight. And then I'm going to let you run the show.
All right. Well, thank you so much. I appreciate it. Well, good evening, everyone. It is my distinct honor to introduce Dr. David E. Ross. He is the director of the Institute of Neuropsychiatry in Midlothian, Virginia. He is a physician that is triple board certified in general psychiatry, neuropsychiatry, and brain injury medicine. Dr. Ross is widely known for pioneering the use of NeuroQuant and NeuroGauge, which is an automated MRI volumetric tools in both clinical and legal settings, including securing a DOPR ruling in federal court for the admissibility and helping to understand the effects of brain injury on brain volume. He was among the very first to use these tools to establish objective brain volume changes in cases of mold-related illness, thereby helping to show a causal link between toxic mold exposure and its systemic effects of brain injury. Dr. Ross has published over 50 peer-reviewed papers, served on national boards in brain injury medicine, and remains at the forefront of research and how subtle changes in the brain can explain symptoms that otherwise might be dismissed. Tonight, we will explore how he first translated volumetric imaging into admissible forensic evidence, how that played out in mold exposure cases, and what he envisions are the next steps forward in the neuropsychiatric medicine. Please join me in welcoming my good friend, Dr. David E. Ross. Hello, Dr. Ross. How are you?
Hi, Shelley. Good. Thank you for that very kind introduction. I've known Shelley for 10 or 12 years. We've gotten to be good friends and colleagues, and I know her to be the leading grassroots advocate for patients with mold-related illness in the country. She's done a tremendous amount of work, especially in military settings. And so I'm proud and happy to be your friend. And I've known the Normie people a shorter time, but also they're my new friends and colleagues. And our connection was Shelley and Dr. Andrew Heyman, who also serves on the medical board. So I've already become very excited about the work Normie does. You're by far the best group for working at the interface between construction and air quality indoors with the medical field. It's always been a big gap, and you guys have by far been the pioneers in bridging that gap. So everybody, tonight I'm coming, of course, from the medical side, and I'd like to show you some slides. Can I share my screen?
Sure, absolutely.
Okay, I will do that, and then let's see if we can then do the slideshow.
Perfect.
Which button? This one? No. What? I just made a new slide.
Under slideshow, I think. At
There
the
you
top.
go.
Yeah, there you go. From the beginning on the left.
Thank you.
You got it.
I'm better at neuropsychiatry than at tech.
You did fine.
So tonight I'm talking to you about chronic inflammatory response syndrome, abbreviated as CIRS, and that's the technical medical name for mold-related illness, and how that relates to MRI brain volume measurement. That's an area I've done a lot of work with, very valuable with our patients who have mold, and how it can be used to detect objective signs of illness, and I'll explain how important that is. Yes, I'm a neuropsychiatrist, and neuropsychiatry is the area of medicine in between neurology and psychiatry. Most of my patients suffer from chronic effects of mild to moderate traumatic brain injury, but my second most common type of patients suffer from mold-related illness. And so what I want to try to cover with the time we have is a little bit of introduction on the neuropsychiatry, that is brain medicine of CIRS or mold-related illness. Then we'll talk about the MRI brain volume measurement with software programs called NeuroQuant and NeuroGauge. And then we'll talk about applying those techniques and measuring brain volume in our patients with CIRS, and then how that relates to what Normie and you all do. So as I'm not sure how much you all know about this area, but so I'll give some basic things for people who may not know. But CIRS, or mold-related illness, occurs when a person is exposed to a damp, moldy indoor environment. It could be a moldy house, moldy place of work, anything like that. And it causes a lot of problems. Immune system dysfunction really seems to be at the core of it. That can include allergies, and inflammation is a core symptom. Really, most of your, or even all of your body is inflamed. That's the core problem. It can affect any organ system, including respiratory tract, can give you asthma, wheezing, neurological conditions, including the brain, which is what I'll be talking about tonight, and many other systems in the body. Regarding the neuropsychiatric or brain-related symptoms, it causes many symptoms, including cognitive impairment like poor memory, poor concentration, mood impairment like depression, anxiety, poor sleep, fatigue, impaired balance, coordination, and movements. Now, there's some peer-reviewed literature on brain volume, actually brain imaging studies, both functional and brain volume studies, as well as my own clinical experience. I've seen hundreds of patients who have CIRS now, and done brain volume measurement on most of them. Been doing this for about 10 years or so. And generally what we find, to make a long story short, is that there's can be increased or decreased cerebral blood flow, which correlates with level of brain activity. There's increased volume of multiple brain regions. That just means the brain or subregions of the brain are too big. Think of inflammation or swelling. But you can also get decreased volume, shrinking or atrophy of brain regions. We tend to see that later when a patient's been more chronically ill, as if there's inflammation and swelling acutely, subacutely, and over months or years. If you continue to have the illness or exposure, your brain can start to get very injured and can shrink down. And also, interestingly, there's abnormal asymmetry of multiple brain regions where one side is bigger than the other. We'll come back to all these in some detail. Give you a little orientation. So what we're talking about with brain volume measurement is that the patient will get an MRI of their head, which looks like that. That produces these images that looks like this. You've probably seen these of in one shape, form, or another. We call these grayscale images because they're colored different shades of gray. And in real life, the brain would look like that. Then we use NeuroQuant to measure the brain volume. NeuroQuant is a software method for measuring MRI brain volume. It's FDA cleared. It's 100% computer automated, making it completely objective. And it's currently the clinical gold standard for measuring MRI brain volume in human subjects, really in the world. And NeuroQuant has done well over 1 million brains. They have great algorithms for identifying brain regions very accurately. They now have 7,000 normal controls in their database, which is basically a world record for this sort of thing. And we've been doing work with NeuroQuant since 2010, and our group has published 17 peer-reviewed papers, all in the area of patients who suffer from chronic effects of mild to moderate traumatic brain injury. And that serves as a foundation for the research we're now actively doing in patients with mold-related illness in collaboration with Dr. Heyman. And what does NeuroQuant software do? Well, this is a typical grayscale image. Imagine this as the patient facing us, and their left ear is here, and the right ear is here. And you can see the gray matter on the surface, which is called the cortex or cortical gray matter, the cerebral white matter underneath that connects the cortical regions to each other to help process the information, and then these subcortical regions. And NeuroQuant, when we get the MRI grayscale images, we'll send it to the NeuroQuant computer server, and in about 10 minutes, it gives us back a colored brain image that looks like this, with the different brain regions and subregions colored different colors, and then the volume is measured. And as we talk about volume measured, it just means how big is the brain region or how small is it? Is it abnormally big, abnormally small, or is it normal volume? And this is an example of a patient with severe brain atrophy. And you should be, even though this is a little bit older technique, which by the way tells you how far the NeuroQuant technology has come. But you see gaping holes or spaces in the brain here around the surface. The ventricles, which are these deep cavities in the middle, they're filled with cerebral spinal fluid, which is a watery substance. They've gotten bigger because as the brain has shrunk, the ventricles get bigger to take up the extra space inside the skull, which is the main job of ventricles. Dramatically different from this normal brain, which is this is a typical appearing normal brain for someone in their late teens to early 20s. There's very little space between these surface regions of the brain, just a little bit. The ventricles are very small. And then as you get older, there's some normal aging with a little bit of shrinking, especially in your 50s, 60s, and in your 70s and 80s, it starts accelerating. But that's a little basic background. This slide, I mainly want to show you, this is a picture, two pictures of the left side of the brain. And just name the big parts of the brain. Your sensory information comes in through the temporal lobe, and this is hearing. The occipital lobe, which is vision. The parietal lobe, which is sensation, like touch, feeling, hot and cold. And then all your movement is generated by the frontal lobes. And that moves every part of your face and your body. And then the very front part of the frontal lobes is, this is planning movement, this is executing movement, and up here is judgment, foresight. And the cerebellum we'll talk about, it's lower and back part of the brain, very important for coordination of thought, movement, and emotion. Then you have the midbrain and spinal cord connecting the brain to the lower body. And this is the inside view of the same thing. Now keep these the images in mind as we go to the next slide. And this is the same left side of the brain and flipped around. It's still the left side of the brain. And the purpose of this slide is to show you that the surface regions, called cortical regions, which are made of gray matter, have many subregions that do different specific functions. And NeuroQuant measures all of these regions. So even though all of the cortical gray matter is colored red, there are really many little subregions all around here that are the volumes measured. Currently, NeuroQuant measures 230 volumes and asymmetries, a very, very thorough assessment of brain volume. So to explain a NeuroQuant report to you, I'll talk about a case I had about 10 years ago to 12 years ago. And this was a 36-year-old woman who had CIRS, and her husband and her kids had CIRS as well. I'll mainly focus on just her to keep it a little bit simple. And she lived in environments with toxic levels of mold and related biotoxins back in 2010, 2011, which caused mold-related illness. And it was really a tragic and disturbing story because she was married to a military service member. They lived in military housing. And you would think our military would protect our soldiers and their families. But there was mold in their apartment. The private military housing company that, was contracted by the military and the government, didn't want to do much about it. finally, the family called in a private inspector, like you guys, and they took down a wall because, as you know, mold often grows behind walls. You might not see it. And this cloud of smoke came out, which of course was mold spores, and other biotoxins. And our patient here immediately had a severe reaction with allergic symptoms and dizziness and vomiting. She had to go to the emergency room. Not long after the exposure, she had severe asthmatic symptoms, which is fairly classic for our patients with mold-related illness. And she had symptoms before this that were accumulating, but after that day and that massive exposure, she had a severe increase of symptoms, unfortunately. I'm just listing here the brain symptoms. She had symptoms of multiple body systems, but we'll just focus on the acquired brain injury she got from this mold-related illness. And only a few of the brain symptoms. There are multiple types of cognitive impairment, impaired concentration, distractibility, can't find the right word to say, slurred words, slow thoughts. She had impaired sleep and wakefulness, trouble sleeping at night, and fatigue, decreased energy, trouble coordinating her movements, visual problems like visual spatial impairment, being very sensitive to bright light, tunnel vision, and mood impairment, including depression, anxiety, and irritability. These are all very, very common symptoms in my patients with mold-related illness. And so she sued the private military housing company, and this went on for quite a while, as lawsuits can do, back and forth. She had a mold doctor, and by the way, disclaimer, I'm not a mold doctor, but I hang out with a lot of them. And I always work with mold doctors with my patients in my cases. And the mold doctor testified, she has mold, more or less the story I'm just telling you, plus the other symptoms, et cetera, and the testing results. And the defense said, well, we don't think she had mold-related illness. We don't even think it's really a thing. It's not taught in mainstream medical schools and medicine, which unfortunately is true, although that's improved a lot in recent years. And then, so it goes back and forth like that. And then the defense says, well, all her symptoms are based on subjective reporting. Subjective means it's possible to exaggerate or fake the symptom. Contrasted with objective, which means it's impossible to exaggerate or fake a symptom. And so in court, when something may be controversial or people don't know a lot about it, they're skeptical of it, they're going to be more convinced if they have objective evidence, like a lab test, a brain scan, a blood test. With psychiatric disorders, for example, and I'm also a general psychiatrist, we almost never have objective signs. It's all subjective report. Patient says, I have trouble thinking, I'm depressed, I can't sleep at night. So I've been very comfortable with that my whole career. But when you can get objective signs, even better. And so my role was to come in and explain the brain injury, the symptoms it caused that we just went over. And then we brought in the MRI brain volume measurement. And this is an example of a NeuroQuant report. And this one was an older report, but still gives you a good idea of what current NeuroQuant reports do. And this was her first MRI in November 2012. And to orient you to this report, there are brain regions in this column, brain regions in this column, and in these columns, we have the volumes, left side of the brain, the right side of the brain, and total, which is left plus right. And actually, technically speaking, they're not volumes, but they're normative percentiles. What is that? That means for any region, let's say her left cerebral white matter, which is a really big part of the brain, all the white part here on the left, was at the 5th normative percentile. That means it was smaller than 95 out of 100 normal women her age. That's very small. That was almost the cutoff for abnormally small, but not quite. So it didn't get the red flag. Here is one region that was very small at the first normal percentile, and that's flagged red. But she had much more blue areas, which is abnormal enlargement. For example, her cerebellar white matter was abnormally large, as well as her gray matter. And then you get some other areas of enlargement in frontal lobes, parietal lobes, occipital lobes, temporal lobes. Most of the major lobes had abnormal enlargement. There's more abnormal enlargement here than you would expect by chance alone. And they cluster together anatomically, which is not a chance pattern. So this was a clearly abnormal pattern of brain volumes. The abnormally large volume was likely due to inflammation of the brain, and it correlated with her symptoms. If you recall her symptoms, the cerebellar regions are important for coordination. She had problems with coordinating movements. The inferior frontal region is very important for producing speech, moving your tongue, moving your lips, as well as the cognitive aspects of thinking what words to say. And she had problems with both of those things, with slurred speech, trouble finding the right word to say. She had problems in the occipital lobe, which is very important for vision. Remember, she had several visual symptoms. And then some of these other regions. Now, we did a second MRI, which was, let's see, about 9 months later to see how things progressed. Unfortunately, it got a little bit worse. There's a little more red here and a little more blue. If we go back the first one and then look at the second one, the pattern, you'll see that. Now the cerebral white matter is clearly abnormally small. And remember, this is outlined a very big part of the brain. The cerebral white matter is 41% of your brain volume. And so the left cerebral white matter is about 20% of your brain volume. And it connects all the other parts of your cerebral cortex. And when that doesn't work right, you'll get problems like inattention or distractibility, especially, but really, which she had, but really you can get almost any, brain problem from this because it connects these specific cortical regions that we've been talking about. The cortical gray matter was also abnormally large. That's the pink region. In fact, it's all this reddish colored region, all added together on the left side. So I really should point to the left side. Again, huge part of your brain, extremely important. And this is known from the literature and from my experience to be abnormally large in patients with mold-related illness. Same with the cerebellum, especially cerebellar white matter, and that's the lighter colored part of the cerebellar. Abnormally large, we know, in patients with mold-related illness. Same with the thalamus, the region in green down deep here, very important for attention, a lot of different things, and also especially attention, sleep and wakefulness. Remember, she had insomnia and fatigue. This area, an anterior cingulate, which is not really shown here, but it's near the middle of the brain, but around this level. That's important for regulating mood. Remember, she had depression, anxiety, irritability. Again, we see the inferior frontal lobe affected, and these other regions we talked about before. So she had persistence of abnormal brain volume correlating with persistence of clinical symptoms, and actually some worsening of the brain volume over time. So we talked about that. We presented that data. Our data was, fortunately, the brain image data was accepted into court. So she won her case at court. She and her husband was the actual court case. And so we were happy about that. It was a landmark case, happy not only for her and her family, but for all the patients with mold-related illness who struggle. It was the first case, as Shelley mentioned a little bit in the introduction, of where this data was admitted into federal court and passed the Daubert standard, which is the standard to keep junk science out of the courtroom. You have to pass standards like peer-reviewed science and FDA-approved methods and things like that to get into court. And that was the diagnosis of CIRS itself, the diagnosis of brain injury due to CIRS, and these brain volume measurement methods. We talked about NeuroQuant, and next we'll be talking about NeuroGauge, our own software. So that was a landmark case. And this is big because federal court sets, all courts set a precedent. That means if you get a positive ruling, it's more likely the next court will also give a positive ruling on the same sort of thing. In federal court, the precedents there and the rulings there carry more weight than state or local courts. Now, I mentioned asymmetry a little bit. Let me tell you what it looks like. This is a different patient, and this is a cross-section kind of near more or less the middle, a little bit to the back of her brain. And you can see her ventricle on one side is much bigger than the one on the right. And so that's an asymmetry, because these should be roughly mirror image to each other in size. And interestingly, 3 different radiologists looked at this, or other MRIs close in time had the same thing. And none of them called this as abnormal asymmetry. Only one of them even said it was asymmetry. When we did the NeuroQuant, and it's even easier to see, and actually all of a sudden this area pops out to your visual attention. Well, it's the same here, it's just not as easy to see. And this is the hippocampus, very important for memory. It's so small on the right, you can barely see wisps of it. And we measured these and found they had abnormal asymmetry in this case. And that turns out that's important for traumatic brain injury, which you might suspect, because if you get hit harder on one side of the brain, maybe it'll shrink up more on that side. But also, very interestingly, occurs more often than you'd expect in patients with mold-related illness. So we've been talking about NeuroQuant. NeuroGauge is our own software we've developed here since 2010. It's based on NeuroQuant. It takes the volumes and the norm percentiles out of NeuroQuant and does some additional analyses, including radar analysis, I'll tell you about that, and longitudinal change over time. Now we're into our modern methods where things have improved a lot, both the NeuroQuant software and our own NeuroGauge. And so here you see a NeuroGauge radar table where we have the brain volumes on the left column, and it's similar to the triage report I showed you, but it has more data. Left-sided volume, right-sided volume, total-sided volume, and now we also have a column for asymmetry, which we didn't have before. And these are the normative percentiles. If abnormally large, they're green. If abnormally small, they're pink. We don't have any of those here. And if abnormal asymmetry, they're purple or yellow, depending on whether it's left smaller than right or right smaller than left. On the right side of the screen, we have our NeuroGauge literature review, where over many years now, we've reviewed common brain disorders, including traumatic brain injury, Alzheimer's, mold, and others. And if we've reviewed the literature and there's brain volume literature, it gets a white background. If the literature pattern matches the patient pattern, it gets a green check. And if the literature pattern is opposite of the patient pattern, it gets a red X. And this is automated also. So once this data is fed in, it will automatically populate these cells based on the literature. And this allows clinicians to more easily interpret the results. So you go down the columns and say, well, where do you get the best match? Where do you have the most green checks and the least red X's? For this patient, it happens to be chronic, mild, or moderate traumatic brain injury. And you'll see green checks, couple X's, a lot of green checks, and more green checks than X's. Now, let me say for mold, you see 3 green checks, which actually, believe it or not, is kind of a lot for the mold column. Why is that? Well, if you look at all these gray rectangles, you realize how little peer-reviewed published literature we have on brain volume and mold. In fact, there's only 2 peer-reviewed studies, which are about 10 years old now, and that's why we're doing research on it now. And I hope within a year when we finish our study, we'll have all white rectangles, meaning all of this data filled in with peer-reviewed research. Then we come down to the bottom half of this table, and we have all the other brain regions. All the brain regions NeuroQuant can measure between the top table and the bottom table. And you see again, chronic mild TBI, because there's a lot of abnormal enlargement, and the other ones don't match as much. There's only a couple regions here for mold. She didn't happen to have those. Although hippocampus was 90 percentile is pretty large, and that is an area for mold, but she didn't quite get it, this patient. The other thing that NeuroGauge does is longitudinal analysis. And for the sake of time, I'll have to skip my incredible shrinking man story and just tell you that by measuring someone's change over time, you have a much more sensitive or powerful way to pick up problems in the body and in the brain. And we developed software to do just that with NeuroGauge. And you can see here a lot of brain regions. And if it shrank abnormally fast, there'd be a red color for atrophy. If it enlarged abnormally fast, we'd see a green color for enlargement. And what we see in our chronic mild TBI patients, and we have early indications of this in our mold patients, is that early in the course of illness, the first weeks and months, you have more enlargement at one time point, and it enlarges over time with ongoing illness and exposure due to inflammation, we think. But after a year or two or more, some of those regions can start to shrink down due to the injury. So in summary, with mold, the brain volume pattern is enlargement of many brain regions on average, shrinking of a few, abnormal asymmetry. And why is that, by the way? Because you think mold would get in through, you breathe it, gets on your skin or your food, will go in your bloodstream and be pumped into both sides of your brain the same. That's probably more or less true, but one theory we have for the asymmetry is that we see a lot of overlap clinically and with brain volume pattern, as you might have noticed, between chronic mild TBI and mold. And we suspect that in a lot of our patients with mold, that years earlier, they had one or more brain injuries, or maybe they played head contact sports, which gave them a leaky blood-brain barrier, which allowed chemicals from the blood into the brain that are not supposed to be in the brain, that will irritate and inflame the brain. This is some of our research with TBI, and to hammer home the point, as I mentioned earlier with the asymmetry, radiologists usually don't see the type of brain enlargement or mild to moderate atrophy we're talking about in our kinds of patients. But when you measure the volume, we see it with NeuroQuant and NeuroGauge 96% of the time, highly statistically significant. So what's the value clinically for measuring brain volume in our patients? It provides objective evidence that supports the diagnostic process or the diagnosis, or what diagnostic pattern does it match the best. But it doesn't make the diagnosis. We can't diagnose brain disorders simply on brain volume measurement. Not yet, probably one day, but not yet. It's terrible to have abnormal brain volume, but if you have it, it provides vindication for patients. And that can be therapeutic in itself, whether you have jury members or a judge that doubts the truth of what you're saying, whether it's a disability income, evaluation, trying to evaluate you and not sure if you're really that ill. Sometimes it can be even your own family members wonder, are you really sick, or are you just not motivated to do the chores around the house? And even patients sometimes themselves, well, they'll go to different doctors who don't believe in mold, never heard of it, and they'll start thinking maybe it's quote unquote psychological or quote unquote all in my head. And when they see the brain volume abnormalities, they go, it's not just me being crazy or something like that. I have a real biological based disorder. Um, and this brain volume abnormalities can enhance adherence with treatment. Patients get more serious about it. What can I do to reverse the brain volume problems, doctor? And there are things you can do. It can track response to treatment. And of course, the number one treatment in mold-related illness that everybody agrees on is to get out of the moldy house or the moldy environment. And we know that's easier said than done for many reasons, one of which is if you move to a new house or apartment, that might be moldy too. As our patient we talked about with the federal court case that happened to her, she moved in a couple different places, they had mold too. So that's where you guys come in. Your work is so important to build houses that are mold and biotoxin free and to remediate houses so that they can become mold and biotoxin free. Finally, the volume measurement is can be used as a screening test for future brain disorders. And there are many of those. One of the best examples is Alzheimer's disease. This is a whole nother story. I won't have much time, but I'll just give you a hint. It turns out that nowadays, Alzheimer's disease is reversible in the large majority of cases if you catch Alzheimer's in the early stage or the pre-Alzheimer's stage. And this work was pioneered by Dr. Del Bredesen, a neurologist who applied a functional medicine approach to Alzheimer's disease. And he typically, and his doctors, he's trained many doctors now. They've published a couple peer-reviewed studies supporting the conclusions I just told you. And I have other doctor colleagues now that have found this in their patients. And like good functional medicine doctors, they check like dozens of different possible problems. With Alzheimer's, these doctors find several that are abnormal in Alzheimer's, and they treat all they find. And they say the biggest ones and most common ones that contribute to Alzheimer's are diabetes, no surprise, cardiovascular disorders, hypertension, high cholesterol, no surprise, and mold-related illness, believe it or not, is a main cause or an important cause in at least half of patients with Alzheimer's disease. So that what you're doing and what we're doing ties into another huge part of medical care and ability to treat it. Then finally ending up with a few practical issues. How does a patient get something like this? Well, they can go to their local MRI center. The MRI scanner has to be set up exactly right to allow obtaining MRI images, brain images, that are sent to us here in the Richmond, Virginia area, where we send them to the NeuroQuant computer server that analyzes the brain images and generates those triage reports I told you about. And then we use that to create our NeuroGauge reports. So to end up, CIRS or mold-related illness causes very commonly neuropsychiatric symptoms, brain symptoms, and brain volume that often correlates with the symptoms. They can be readily detected with our NeuroQuant and NeuroGauge methods. The presence of MRI brain volume abnormalities often provides that extremely important objective evidence supporting the diagnosis of CIRS. And brain volume measurement can help track clinical progress in our patients and how they respond to different interior environments, hoping their clinical status will improve, their air quality in their home will improve, and their brain volume will return back to normal or toward normal. So I will end it there and ask if there are any comments.
Thank you so much, Dr. Ross. This was very good. Skip, Doug, do you guys have any questions?
I don't think I have any questions, although I'm absolutely blown away by the information. You made it so practical. Thank you so much. I'm always concerned when I hear neuropsychiatry that the discussion is going to be way up here somewhere. But man, you made it practical. And I think the exciting thing for me about this, Dr. Ross, is it sounds like this getting this information from NeuroQuant, NeuroGauge, once you've gotten the MRI done, is accessible, I assume, to everyone. If I were to go out and get the MRI, though I may have to pay for it, I don't know if insurance takes care of that or not. But once I got that information, I could then send it to NeuroQuant, NeuroGauge, get that information, and then start making drawing some conclusions about whether or not I've been affected by some mold issue.
That's right, Doug. And thank you for the kind comments. So, yes, NeuroQuant can be done on approximately 95% of all MRI scanners. So anywhere there's an MRI center, likely they can do it. If they've never done it before, they have to have just a little bit of training on how to set up that scanner exactly right. We do that with them when we order MRIs or work with other doctors ordering them. So yes, it's very convenient and very important for a lot of reasons. One other little thing I will add on the Alzheimer's story is that Dr. Bredesen recommends screening routinely for Alzheimer's every year if you have risk factors or you're over 50. And that includes extensive blood work, including the CIRS blood tests, online cognitive testing, and MRI brain volume measurement. So, and if anyone knows Dr. Bredesen, I'm trying to get an introduction with him. I'll just throw that out there.
So, Dr. Ross, how would I go about if I wanted to do that and have an annual review? How would I go about getting that prescription? Would I ask my cardiologist to do that or GP? How would I do that?
You could always ask your GP or your primary care practitioner. If you go to some type of brain doctor, neurologist, psychiatrist, neuropsychiatrist, then you could ask them if they would be willing to order an MRI and order the NeuroQuant and NeuroGauge analysis. And if you need help doing it, we could help advise you on that, or talk to your doctor for you, or send you information if they don't know about it.
Okay.
Yeah. So if you're my patient, of course, we also do a lot of clinical work. If you're my patient, or if I'm licensed in Florida and Virginia, if you're in those states, I could do an evaluation or telehealth or face-to-face in Virginia, and I can order the MRI and I can order the NeuroQuant, which makes it easy. But yeah, otherwise I got to work with your doctor.
Gotcha. Cool.
To stay within the theme of neuropsychiatry, this is crazy. I mean, this is just nutso. And I mean, can I salute you for being at the forefront of this? And this type of information, I mean, my phone this is unbelievable. I mean, people are texting this. I want to also thank you. You were so gracious to say what you guys are doing at Normie, is critical, because we talk about this all the time, the value of the assessment. And now here you are bringing to the forefront 50% of Alzheimer's is associated with mold. It's potentially reversible if you catch it in the pre-Alzheimer's state. I mean, this is earth-shattering, and the time is now. The environmental issues must be aligned with clinical, and to be so honored to be getting to know you and your work. Thank you for your work. Thank you for your work, and also acknowledging the critical nature of what we do on this side of it. I do have one question, however. When you see this atrophy or inflammation, when the patient's environment is such that they're no longer being exposed, what do you see in follow-up NeuroQuant, NeuroGauge as far as things normalizing? Is it different with everybody? Because what I just took from this is it's very consistent from mold exposure, the parts of the brain, very consistent from an atrophy, very consistent with inflammation. But what do you see that trend Is it 12 months, 24 months, 36 months? Yeah, how long do things take to normalize?
Yeah, and unfortunately, Skip, I don't have a lot of data on that. I have a handful, and it seems to take months or a year or so to get some reversal of the brain volume findings. I do see that sometimes. There's a very big literature on a lot of different brain disorders do have reversal of abnormal brain findings, including TBI, stroke rehab, and other things. But a challenge we have is that our poor patients, you know, half of them at least can never work again, and the rest have trouble working. They extraordinary medical expenses. They don't have any money, and then it becomes hard to do follow-up MRIs. That reminds me, Doug, you asked for the first MRI. If you have a history of traumatic brain injury, which about half of our patients do when you ask very carefully, or head contact sports puts you at risk of brain injury, even if you never had a full-blown concussion, insurance will almost always approve it for that first one. And then sometimes they'll approve it for the second one. For mold-related illness, it's more hit and miss, but often still they do approve it, but sometimes not. So those are some other financial costs that come on. In addition,
But typically, they're not gonna pay for one every year, is your point?
they might not. Yeah, they might not. They might not. Sometimes they do. So depends on your insurance, of course.
So Randall Smith had a question. I think I made your mic live,
Yes.
Randall.
Can you hear me?
Yes, sir.
Yes. In fact, you just hit on the question, but I'll ask in light of your answer on funding. Okay, if I had a concussion when I was back in college, is there any way that can help the insurance pay for follow-up when the mold is my concern of more recent times?
Well, not knowing your specific case, but by the way, I like your house cat in your picture there. Um, but in general, I'll say, usually in my patient, a remote history of TBI is definitely a risk factor. That's our theory I was mentioning. That's the exact theory that you could have a TBI early in life, which injures not only the brain, but the little small blood vessels that go into the brain, and they get injured, and that's the blood where the blood-brain barrier lives, and it gets leaky. But you might not get mold illness until you move into a moldy house years later. And it's the combination that puts you over the threshold. And you might, so that would be a reason, in my opinion. Even head contact sports would be we know football it does cause subconcussions, meaning none of the head hits were enough to give you a full-blown concussion. But when you get about 200 or 300 of those over a football season, your brain shrinks. And there's peer-reviewed literature on that.
Thank you.
Hey, Dr. Ross, what are you doing for patient recruitment? We're going into sensitized individuals' houses and so on and so forth. Is there a way that we can facilitate that for you? That's the first thing. And secondly, we have to have you back because we cannot have you conclude this presentation without you telling us about your incredible shrinking man story.
Yeah, I secretly left that as a teaser, and I'm glad you bit the bait on that.
I did.
Yeah. Let's see. I'm sorry. What was your question? Speaking of poor concentration.
That's okay. How can we help with
yes.
patient recruitment for you? Because you've done a lot of publishing. Your NeuroGauge, there's not a lot of published information. How many patients do you need? What can we do to facilitate that in just sharing awareness, sharing that this technology exists? What can we do in that regard?
Well, that would be fantastic. And, our research is all almost, I'd say 95% internally funded over all the years. we recently had a little bit of external funding, and I'll give credit to Dr. Heyman, who funded part of our research imaging assistant position to fund our current mold NeuroQuant study. But I found with mold-related illness, ideally you want research patients who never had any brain problem, then got mold-related illness, and then you know, it rules out previous brain problems that can affect brain volume. So it's a nice clean study. We went through our own patients, and there were many dozens, and we found almost no one that didn't have pre-mold brain problem, which is interesting in and of itself. It's quite different from our TBI patients, where maybe a third of them don't have a pre-brain injury brain problem, at least a quarter. So it was a lot easier to recruit. That's why we did all that research on them. But mold, very hard to find. We have teamed up with Dr. Heyman, and he's referring us some patients, but it's hard for him to find. We finally loosened our criteria a little bit, so we're ruling out most of the big bad brain disorders like, Alzheimer's and alcoholism and progressive dementia. But we're letting some of the common ones in just so we can have patients to study. And in a sense, so my suspicion is that mold-related illness starts way before anybody thinks it's mold-related illness. You've got brain problems, and you might have other medical problems, and they could kind of simmer for years. That's what happens with Alzheimer's, and I suspect I'm getting a little bit out of my area since I'm not the mold doctor, but that's what I suspect is happening, at least from a brain point of view.
Dr. Ross, one of the things we might be able to do, I just thought about this, Skip and Shelley, because we're doing this intake interview process, it would seem like we might be able to filter some of those, or at least give them access to a website, or somehow send that patient to you so you could, filter, find out if they might be qualified for one of the tests that you want to do. If you think that would work, we ought to talk about doing that, Shelley.
Most definitely.
That'd be great. Thank you. Yeah, that's definitely the rate limiting factor on this research is getting enough patients.
Well, what's so funny, what's so interesting about this to me, Dr. Ross, and I think Dr. Heyman really underscored this for us, because I think he sees it the same way, is we really are in a lot of ways kind of the first line of defense. A lot of times people have a problem with their house and have never seen a doctor. They don't even know that there's necessarily a connection, but they think there might be. And so the people that we're talking to oftentimes don't have a clinician or a medical doctor that they're working with. And so giving them those kinds of resources, that's why we put on our website now a public library with research documents that we can give to them. But that might be a great kind of a opportunity in a market that maybe a doctor wouldn't have access to because they're coming to us first.
That's a great point. And maybe one day Dr. Bredesen will have to add to his list for periodic screening of Alzheimer's a NORMI certified assessment or follow-up on the house or remediation of the house.
I'm gonna find him, and we're gonna connect. Somehow we're gonna connect.
Tell him I sent you.
There you go. Well, listen, thank you so much. It's a little bit past time, but we are going to invite you again. That was phenomenal. I look forward to hearing the story about the shrinking man. But we are going to have you again if you can, give us an opportunity to do that. Thank you, Shelley, for making this happen. Absolutely fantastic. Thank you, Nathan and Skip, for being here, and all of the Normie members for taking the time to be here. We've recorded this. We're going to put it on our website for people to see, and probably eventually put it on our Normie TV channel. These kinds of things are so important I think, for the public, because it's so practical. It's not that high level discussion where you're hearing words you can't even pronounce, much less spell. So thank you so much for making it more of a lake discussion for us.
So
Yes.
next time I can't talk about the phase angle and echo time of the MRI physics.
There you go. Go for it. As long as you have subtitles, I'm good.
Dr. Ross, when you're here, it's your hour to educate and inform.
Yes.
That's exactly right. So thank you again. Thank you so much. And thank you, everybody. Have a great evening. And we'll look forward to seeing you next Tuesday night.
Thanks,
Good
everybody.
night.
Much.
Appreciate all your
Thank
great
you.
work.
Thank you. Thank you. Thank you. Thank you.
Bye-bye.